Thanks, Philip, and welcome to Today in Putnam County. Thank you for joining us this morning. Hope you're having a great weekend. My goal with the show is to interview the people that help our county keep moving forward and make some of the great things happen in our county. So let's get started this morning. My guest is Lisa Bumbalough. She's the director of the Putnam County Health Department. Good morning, Lisa.
Good morning. How are you?
I'm great. Thanks for being on the show.
Yes, thank you for having me.
You're a director of our health department and have been for several years now. And so I want today to talk about all the services that the department has to offer. Lots of folks do not know, I think, enough about our health department and the things that it has to offer our community. So before we jump into that, how long have you been with the health department? I know it's been several years now.
It has. I actually started working for the Department of Health through the Upper Cumberland region in 1997. I was the HR manager, and I transitioned over into the actual department here on Willow in 2006 as the director. So I've been there ever since.
So that's several years. You do a great job. We have a great
you.
health department. I think one of the best in the state.
Well, I think so too, but you know,
We
I
may
might
be a little
prejudiced.
prejudiced on that, but I think there's a lot of other people that agree with us, and a lot of that's attributed to you and your leadership. But you got a great group of employees over there.
Sure do.
70-something employees.
72 employees right now, and we have lots of different disciplines. You've got physicians and nurses and nurse practitioners, but we have folks, you know, a lot of administrative folks that work in the front that actually are the face of the health department when you come in. We have social workers, dietitians, community educators, so we have a great group that really work together to make sure that our mission is accomplished, you know, and I think that you have to have a heart for public health. You have to have that heart to want to serve others.
And it's a servant's heart.
It is.
And you have to be dedicated to wanting to help people to be able to do that job. You have a great group, and it's a team effort.
Yeah.
Like we talk about in Putnam County, everything we do here is team oriented, and the health department's no different. I've been amazed over the past several years at the number of visits that the health department is seeing and how that's increasing. Of course, built a new building, moved into in 2009, and it's been amazing how it's been going up. I was looking at your numbers, 13,500.
Yes, last year, 2018, 13,500 unduplicated patients. So unduplicated means if you came in 10 times, obviously we are counting you as one. Right, and when you think about that, that's 1 in every 5 residents of Putnam County
that come to the health department
that have received some sort of service. It may have been for a primary care clinic, but could have been for a WIC, it could have been for a birth or death certificate, but
could have been driving through the drive-through, sticking your arm out the window,
exactly
getting a flu shot.
I mean, we're well known for a drive-through flu clinic.
Who would have thought a drive-through flu clinic? I mean, it's great though for folks to be able to. They don't even have to get out of their vehicle. They circle around through your drive-through. Nurse sticks them with a shot, and they're on their way.
Yeah, they get a smile, and you know.
It's great. It's great. I know that your mission for the health department is to promote and improve the health of the people in Putnam County, which you do a great job. That's becoming more and more difficult, though, isn't it, with all the diseases we're seeing?
It is. You know, there are the greatest causes of premature deaths and preventative illnesses are directly related to how we live. Our day-to-day lives, what we eat, what we drink, if we exercise enough, or even if we don't exercise, if we smoke, use tobacco. So those things are our choices that we make, and that affects us and it affects our community. So I think the health department is really trying to be a little more proactive and focus on prevention out in the community, you know, to let you focus on the fact that, okay, my well-being, my good health is my responsibility.
It's all about choices, isn't it?
Yeah, it is.
The choices that we make on a day-to-day basis, if we're eating fast food, hamburgers, french fries, and all that kind of stuff, compared to the home cooking that maybe we were used to growing up. There wasn't a lot of fast food back then. It's made a difference. Obesity, big issue we have in our country. Do you see that a lot?
Yeah, it sure is, and I think it's on the rise because it's a fast-paced world. We're always in a hurry, and everything is about instant gratification. So I want it, and I want it now, and I don't want to wait.
Don't want to wait.
And, you know, but you can eat healthy and make good, healthy food choices on a budget. And you can do that quick. You know, you can make up a salad and grill you some food. You can eat fresh fruits and fresh vegetables, and it's quick, and you feel good after. You know, I feel a lot better.
And educating people
That's
to that effect is the answer. Also, exercise. I know for me, and I have a hard time finding the time sometimes to get out and exercise, but when I do, I feel so much better. It's like an energy boost to be able to
But
do
boy,
that.
you can sure talk yourself out of it before
It's
you ever
easy,
go in
isn't
it. You
it?
just think, well, I have this
All
to
the
do.
excuses, you know, I'm tired, I don't feel good tonight, I need to be doing this or that,
But I think not just physically, but it emotionally helps us, and it improves their mood. It makes us probably better to be around, more comfortable to be around too. You know, because you feel better about yourself.
it's hard to get people to do that though, isn't it? We provided through grants through the state, through the health department, we've got walking trails throughout the county, at our
Yes.
parks, our soccer complex, those places, and yet we don't see that many people using them.
No, we don't. That's sad. That's really sad. But it's a choice. It's a choice we all make. And I think once we realize that our health and the choices that we make right now, every day, actually affect our quality of life and our length of life, hopefully we'll make a difference.
How do we compare to the other counties in the state? When you start looking at Putnam County, we're a booming, growing county. I think population, we're somewhere around 18th or so, but when it comes to our health and our health department, and how do we rank against the other counties in the state?
Well, I don't know if you've heard of the county health rankings or not. That was a study done by Robert Wood Johnson Foundation in the University of Wisconsin, and they do these rankings every year. And they actually conduct them to help counties understand what influences the residents' health and their length of life. And it's really good for local officials, city and county officials and local organizations to determine what factors they need to look in to drive improvements in the community. And in Putnam County last year, we ranked 24th out of 95 counties.
Wow.
So not bad. Not bad at all.
Right.
Of course, 23 were ahead of us,
Right.
but there were several that were
We're
definitely
worse than we were.
us.
Yeah.
And what health outcomes means, the way they rank that, is that's the length of life and your quality of life. So they're looking at premature deaths in the county. They're looking at low birth weights and poor health days of the residents. So that's health outcomes. And then in health factors is another way that they rank counties. We were 29th out of 95.
Still pretty good.
Still pretty good. And that's more your social and economic factors. What we've talked about, it's how well we live. Do we make good choices?
Right.
Do we walk and exercise like we need to? Do we eat the way we should? Do we use tobacco? So, not bad.
A lot of different factors go into that.
Yeah,
A lot of different
yeah,
factors
it
go into
does.
that. You're listening to Today in Putnam County on News Talk 107.7 and 1400 The Hub. I'm Randy Porter, your host, or with Lisa Bumbalough after a break. Stay with us. Welcome back to Today in Putnam County. I'm your host, County Mayor Randy Porter. Hope you're having a great Saturday morning. Today my guest is Lisa Bumbalough, and we're talking about the Putnam County Health Department. Lisa, it's almost amazing at the services that the health department offers, and I think a lot of our listeners may not know all of those. Can you kind of run through some of those and give a little scenario or summary of what all those services are?
Sure. Public health, I think, has not always thought about until there's a disaster usually or an outbreak, but we've made some significant, I think, positive impacts on the spread of disease over the last several years.
Absolutely.
But there's so much more services that we offer locally. One being primary care services. And a lot of folks say, what does that mean?
They don't even know about that, do
They
they?
don't understand. But what primary care services are is it's just your typical services that you would expect to receive at your own physician's office.
Right.
We see folks for sick visits, physicals, their annual exams. We manage diabetes and their high blood pressure. So it's just a doctor's office, and we have some really good physicians and nurse practitioners and nurses and this entire staff that really take good care of their patients. And we hear that a lot. We hear a lot of positive comments.
I do too. I hear that in the community. Some of that, we have fewer doctors ratio to the number of people we
Yes,
have in
yes.
Putnam County. Where we used to have a lot of primary care doctors that they had their offices and everybody had their same doctor for 30 or 40 years. You don't see that much
Right,
anymore,
right.
so a lot of folks are having to look to the health department for those services.
They are, and you know, right now, Upper Cumberland region is unique in that we have, we're FQHC status, federally qualified health centers, and that's all the health departments in the Upper Cumberland region, which means that we provide full service adult and pediatric services as well as dental. and
Also, you
preventative.
provide dental services?
Yes, yes,
Someone
we
needs
do.
a tooth pulled, they need a filling, they need a checkup?
Well, we do have dentists across the region, and unfortunately right now I have a vacant dentist position, so.
If you're a dentist out there and you're looking for a job, call Lisa.
Great hours, yes,
Yes.
great hours. But one of the benefits too that you can do, since we are FQHC status, it allows us to offer our services on a sliding fee scale based on family size and income. And we see folks who, I mean, we see obviously the uninsured.
Right.
We want the uninsured to come and see us
Right.
because their service fees are accommodating to them
Right.
based on their family size and income. But we also see a lot of folks with private insurance.
So you
Medicare,
do,
Medicare.
you do take private
We do.
insurance?
We file insurance now. And last year, we saw over 4,100 patients, unduplicated patients, just in our primary care clinic.
That's amazing.
And of course, you know how it is at a physician's office. That's usually you're going every 2 or 3 months to
Right.
see your physician. So there were a lot of visits.
In our community, we have some great doctors. Like we said before, there's just not as many of them on a ratio of the population. It's very hard to get into them sometimes.
Yeah.
If someone's coming to the health department for your primary care services, do they need to make an appointment?
Well, we're very busy. I would love to say that we're a walk-in clinic, but we're
You're
not.
not. You're
We're not a walk-in clinic. We just don't have the staffing to do that. But we're very accommodating, and we usually are able to work folks in. We have a triage nurse that immediately takes the call if you're sick and need to be worked in, and we can always get you in within a reasonable amount of time, a day or so.
So if you're
not
real
that
sick,
day.
it's not a wait a week or two to get in. You
Oh,
usually try to
no,
work those folks in.
no, it's definitely not. We have a lot of new patient requests as well, so we're constantly getting new patients to come to us. And, you know, what we try to focus on is, like we were talking about earlier, just our health and our choices.
Mhm.
But so many of us, when you make those choices when you're young, you don't realize as you get older how that affects you as you grow older. And
If we could all go back and change some of those
I know,
choices.
I know. And I think us working more in the community, doing some primary prevention initiatives,
Mhm.
we want to try to, before you are diagnosed with diabetes, before you're diagnosed with high blood pressure, we want to prevent you
Keep
from
it from
ever,
happening.
yeah.
Yeah, keep it from happening.
So that's education. That's about just what do I need to do to keep my blood pressure
Right.
and what do I need to do to prevent diabetes and any other chronic diseases. So we've got a great group that love to get out and do community education and really bring awareness to the things that affect us
Right.
in our life.
You do a lot with pregnancies and children with your services, right?
Yeah, we do. We have a really good program that has gone through a lot of changes. WIC lately. It's a nutritional food assistance program, and we've recently transitioned to an electronic benefit transfer. So it's away from the old vouchers.
We talking credit card? type
Yes,
thing?
it's a credit card. It's basically what it is, and it's loaded every time you come in for the amount of food packages that you get to receive, and it's so much nicer. The new system makes the transaction so much easier at the local stores, and then much easier for the participants.
Not embarrassing when they
Yeah,
go to
and it's
use
just
it.
quick. It's
Yeah.
not so confusing. You know, when you're out of benefits, you're out of benefits for that
Right.
month. But we see a lot of folks with WIC, and that has helped families. You know, the goal is to make sure that these children receive the nutritious food that they
Right.
need to be healthy.
Right.
And it's our responsibility, I think, as citizens to make sure that we're giving every child a healthy start.
Yeah.
And that's a way to do that.
That's the goal.
WIC generates revenue for Putnam County, and I know I've shared that with
Oh,
you on
yes.
occasion. 1.4 million last
My ears
year.
perk up.
I thought you would. I
Revenue.
thought it would. But $1.4 million came in last year to Putnam County by the voucher redemptions from local stores. So it definitely brings money back
into Putnam County.
into
Plus,
Putnam County.
it's helping our,
And
it's
it
helping our
helps the
kids.
people,
It's
yes,
helping our youth.
that live here.
One thing I get a lot of questions on when I was the coroner, EMS director, was death certificates, birth certificates. That's a big part of the health department.
It is.
I have people call all the time that where do I go to get a birth certificate or
that
death
keeps us-
certificate, and it's at the health
It
department.
is. It keeps us very busy. We issue birth certificates. Sometimes, mothers will come in and they want new copies. They lost theirs. You have to have them usually for school reasons, and then of course you need them many times just for baseball, any athletic teams that you're wanting to enroll in. So we do those. We printed, let's see, I think I have that. In 2018, we issued over 1,600 birth certificates
Wow.
and over 1,000 death certificates.
So we had 600 more births than we
Yeah.
had the
Well,
deaths.
you
Yeah.
can't really look at it
Yeah,
that way
can't compare
because
really
they
that
could
way.
have, the death certificates are if, they deceased
Right.
here. And birth certificates if they were born here at the hospital. Usually they come and get them here. So
Right.
you can't really look at it that way, but
Yeah.
that keeps us very busy. And the funeral homes, we're very fortunate here in Putnam County. We've got good
Everybody
relationships
works together.
with the funeral home, the hospital, and to get it done and get it done timely.
So if someone needs a birth certificate or death certificate, can they just walk in? or do
Yes,
they
yes, we do those on a walk-in basis. We sure do. It's $15, and we take debit cards or credit cards now. So
And new health department we built a few years ago is on County Services Drive, right here across from the radio station, Country Giant radio station. People can come in. You got a newer, bigger parking lot. Come in
We
the front
do.
door and.
county government has been very good to us.
Yeah.
So I'll give you a plug on that.
Well,
They've always been that good to us, and I think that you guys maintain our building so well, and we're really fortunate that the funding was there to make such good improvements
It's
in the
great.
health department.
It's a great partnership. You're listening today in Putnam County on News Talk 107.7 and 1400 The Hub. I'm Randy Porter, your host. Coming up after the break, we're with Lisa Bumbalough in the Putnam County Health Department. Stay with us. Welcome back to Today in Putnam County. I'm your host, County Mayor Randy Porter. Hope you're having a great weekend. I'm talking with Lisa Bumbalough about all the services offered at our health department. Lisa, it's not all about services. It's about community outreach too. And I've been amazed over the last 5 years almost that I've been in office of all the grants and events and things we've been able to do in Putnam County because of the health department. A new one that we just did is a new splash pad for the kids in Monterey. They are so excited to get this new thing.
Yeah, I'm really excited to see that too, and I know John Ross, Parks and Rec, they do so much work. These
They do.
grants that we actually are fortunate enough to get from Tennessee Department of Health, which has been very good to us in Putnam County.
They have. Thank you, Department of Health.
And but Parks and Rec, I know they're ready to get started on it, I think in July. So we should be ready to
It's going to
get
be
moving
great.
on it. It's going to be great. And last year we worked, some of those funds went to Baxter City Park. We made some renovations there and revitalized the park there, and did the walking trail.
Yes, did the walking trail that folks use, and we're putting in an amphitheater, and that kind of started the park in Baxter idea with the health grant. Playground equipment they've got, walking trail, now they're putting in an amphitheater, new historical park for the old school down there, Baxter Seminary, and
Well, in All Good, was it 3 years ago, we used some tobacco settlement dollars to make improvements there and revitalize that area. And of course, when we do those things, we want to make policy change. And you've allowed us to do
no
that.
smoking,
And it's
tobacco use.
no tobacco use. So that has made a lot of improvements there, and really kept folks from being around the secondhand smoke, those
Right.
who really do not smoke and don't want to be around it.
And we're able to do a new playground over Jerry Whitson. That looks great, all the new playground
I'm
equipment
really,
put
really
in.
proud of that. Of course, probably because we did a lot of work ourselves on that, as well as David Funk. He really worked hard on that project for us. Just getting it like we wanted. It's a nature play area.
It is.
So it's a little different look, but I love it. It's got climbing walls and it's colorful, and that park needed some work.
It did. It was very outdated, and there's a lot of the kids and families use that park over there. It's amazing. We're in the process now of updating the ball facilities over there because they're getting used so much.
Right.
But the park, was kind of the start to that process of
that's-
renovating that area. Walking trail at the sports complex, the soccer
Yeah,
complex.
we're hoping to get that going pretty soon. I know you're waiting on that for that matching grant or
Right.
the TDEC grant, so hopefully that will happen. Those soccer fields, you know, it's packed. That's a busy place.
It's unbelievable.
And-
Soccer is growing, lacrosse is growing so much, and so while those kids are there, the children are there playing soccer and lacrosse, it gives the parents or their families
A paved walking trail around it
Yes,
and a playground.
That's
so
right.
I think that's going to be a great addition, and we're just really fortunate, I think, in the community to have gotten what we've been blessed with.
You
Really
go
are.
out into the community a lot, you and your employees do, with attending the events, Slide the City, Red, White, and Boom,
We're gearing up
health
for that Slide the
fairs.
City,
It's
yeah.
coming up real
Mhm.
quick. That's something that maybe all the communities do, I don't know, but I see it so much here with you in the health department. That means a lot for the folks to be able to see you out in the community at those events.
Well, it goes back to our mission. You know, if we're trying to protect, promote, and improve, we've got to be out there doing it. And, you know, as we talked about, so many things are linked, our choices are linked to our quality of life, our lifespan. So if we get out there and at the Slide the City, we plan on having sunscreen available as we have every year, and we'll give you some sunscreen and spray you so you're protected
get
from the sun,
sunburn.
right?
Prevent skin cancer.
Yes, yes.
down
So
the way.
anything that we can do, I think, just to help families and help individuals be healthier, feel better, I think it's a win-win for all of us.
Well, I think so too, for our community. Ultimately,
Yes.
if those folks are healthy, that's less of a task it is onto our emergency services, our hospitals, our doctors, if we
Yeah.
keep folks healthy. You do some worksite wellness plans upon request, I think, also, don't you?
We do. We do quite a bit, actually, and we hate when we have to turn folks away and put them off, because I think when we go out, we want to be sure and help the employer help their employees feel better. That improves productivity.
It does.
It decreases absenteeism, and but we do quite a bit of those, and that's just based on whatever the needs are that the business is requesting. It may be a weight loss, Biggest Loser. It may be just preventing diabetes and lowering blood pressure, or just maybe some healthy eating cooking classes that they want some education on.
Well, and all those programs help with their health insurance also.
Sure does.
That's,
It
if
sure
people are
does.
healthy, that's less claims that they have to turn in and money that they save. Lisa, you do a great job, and so do all of your people at the health department. If people, one last time, if they need to come to the health department, if they need to call to find out things, phone number they could call,
Yeah, it's 931-528-2531,
located at 701,
County Services Drive.
which is right across from Country Giant Radio Station.
It is. It is.
911 Center, Health Department, Election Commission is all down in the same complex. What kind of hours are you open?
Our basic hours are 7:30 to 4:30, but we, to afford our patients a little more opportunities before or after work, for our primary care clinic, we're open 7 to 6 during the spring, summer, and fall. And that, again, is, you know, if you work till 5,
It's hard to-
4:30, it's hard to get in.
Right.
So those hours, I think, accommodate our patients much better.
Well, thank you for what you do for Putnam County and all your folks. Shout out to them, and thanks for being on the show this
Okay,
morning.
thanks for
Lisa Bumbalough, Director of the Putnam County Health Department. It's now time for What's Happening, the part of the show where I keep you informed on some of the special events going on in Putnam County. Tonight is the 2019 Summer Splash, the 5K, starting at Dogwood Park. Proceeds go to benefit local cancer patients, and it's sponsored by Roland Media. Friday, June the 28th, continues the movies in Dogwood Park. It's fun for the whole family, and admission is free. On the 28th at 8 p.m., How to Train Your Dragon. And then on Saturday, July the 6th, they have a bonus movie to help us celebrate the 4th of July weekend. And at 8 p.m., it's Hotel Transylvania 3 Summer Vacation. Our festivities start Red, White, and Boom for the week of 4th of July on Saturday, June the 29th at the Putnam County Fairgrounds. 10 to 2 is our classic car cruise in. With classic cars, trucks, cycles, and tractors, admission is free. Then Thursday, though, for the 4th of July, it starts that morning with our parade and goes all the way through the fireworks that night. We'll start at 10 a.m. With the kids' patriotic parade that goes around the courthouse square. The lineup and registration starts at 9 a.m. at the corner of Free Street and North Washington Avenue. Then immediately following the parade at 10:30, we'll have our 5th annual patriotic ceremony at the west lawn of the courthouse. It's honoring our local veterans, and then after that, we're having a special lunch for all the veterans and active military personnel there at the courthouse lawn. So please come and join us if you are a veteran or in military service. Then at 5 p.m. on 4th of July, we move to the fairgrounds for the Red, White, and Boom concerts and fireworks. The concerts start with Jake Hoot and Smoky Nights. Gates open at 5 o'clock. We have bounce houses and games for the kids, food trucks, and then the fireworks at 8:45. All of this is free to the public, so come out and join us. Then our finale is on Saturday and Sunday, July the 6th and 7th with Slide Cookville. Starts downtown on Broad Street, Saturday from 11 a.m. to 8 p.m. and Sunday 12 noon to 8 p.m. That's what's happening. For more details on any of these events, go to my website, randyporter.org, or my mayor's Facebook page, Putnam County TN. If you have an event you would like mentioned, please message or email me. And Putnam County in the news this week, in case you missed any of it, a new skate park opened at Parkview on Thursday. The park was made possible by a grant from the state of Tennessee, along with funds from the city of Cookeville. New traffic signals were installed at Highway 111 and Interstate 40. They were activated this week. The lights were installed to help relieve congestion and accidents at the busy intersections. If you haven't noticed, over 1,000 cavers have been in Putnam County this week as we hosted the National Cavers Conference in Cookeville. The conference is expected to add about $500,000 in tourism to our local economy. Most of our municipalities, along with the county, are working on next year's budgets. Monterey City Alderman failed to pass his budget on third reading this week, leaving the town to look at the comptroller's office on what to do. I have faith that they will be able to get it taken care of before their deadline on June 30th. One of our local businesses is expanding. Poets has opened its 3rd location at 18 North Cedar Avenue. The new location will also be serving casual dining with sandwiches and bowls. Congratulations to Poets number 3. And finally, a new food service is launching in Cookeville called Waiter. The delivery service has its own app, and officials say they will be hiring around 100 new delivery and managerial staff. The service is similar to existing services in Cookeville, such as Food of Your Mood, We Deliver, and DoorDash. That's our show for today. I want to thank my guest, Lisa Bumbalough with the Putnam County Health Department, for being here. Hope you'll join us every Saturday morning at 10:30 a.m. for Today in Putnam County on News Talk 107, 1400 The Hub. You can also download the WHUB app and listen to us on your cell phone. If you missed any of our shows, go to my website at randyporter.org. As always, thanks to Marconi Award winner Brent Carl Fleshman for producing my show each week. I'm County Mayor Randy Porter, hoping you have a great rest of your Saturday, and may God continue to bless our great county.